So people do better if you actually get them started in a certain way the night before surgery. So we give them something for nausea, we give them something for inflammation, and we give them something for nerve pain. Nerve pain's a big problem in explants. So you got to treat it up front so that it's only in the background. The next day, we have a patient come to the surgery center we're using, bring their medicines, take more gabapentin. Typically, they'll have some Tylenol at the surgery center. We'll do the procedure. Once I've taken out the implants and the bloc technique, I'll inject a longer acting local anesthetic called Explant. And so what this medicine does is it helps blocks the nerve, the soft tissue, and the muscular tissue, as well as the rib surfaces for about 5 days. So you can make all that pain and discomfort that normally would be experienced right after surgery really minimized, so that when they wake up in recovery, they're comfortable. My patients don't need a lot of narcotic after surgery at all. So after surgery, we wrap folks in an ASERF. They go home. They're encouraged to walk 1 to 2 miles a day. I ask them to use an app on their phone or their watch or whatever. That's their exercise pattern. Ice packs, 30 minutes on, 30 minutes off, as much as they can for as long as they can the first 2 to 4 weeks. See them at a week. I talk to them the next day by phone. I see them at a week. And those first 2 weeks are the difficult ones, right? There's this kind of relief that this has been done, but it's also very kind of disconcerting because there's going to be a big appearance change. There's a lot of psychosocial issues, and that's what led me to do more lifting and fat transfers. But just in this basic situation, it's getting adjusted to this new physical appearance. And then, we have a small amount of narcotic. We try to get people week over week, doing more activities so they get the 6-week mark. And then I get people doing more, more strenuous activity, more strenuous exercise. And I continue them on supplements, 3 to 6 months out, and their diet 3 to 6 months out at least. And then I have a bunch of ask me like, well, when do I stop this diet? Or when do I stop these supplements? Or when do I stop doing this? I'm like, well, do you feel better? They're like, yeah. I remember it's not all the implants, right? We just implemented all these different changes about sleep and mood and nutrition and supplementation, exercise patterns. So why would you want to stop any of it? Why would you not just call Stephanie and try to figure out how Stephanie can make it better? Because I'm not the end all be all for this, but I certainly programmatically have my window.
Sure. I want to go, as we wrap up here, I just have a few more questions.